Hello and welcome back to my channel. Today we are going to talk all about tearing and episiotomies, what they are, what the difference is, what one is more preferable if you want a shorter recovery time, and what heals better. I'm also going to talk about my top tips for encouraging healing in that area during that postpartum period for a faster and more comfortable recovery. My name is Kitty. I talk about everything from pregnancy to birth to postpartum here on this channel. If you're interested in that kind of content, please make sure and hit that subscribe button down below and hit the notification bell if you don't want to miss any more of my videos. So I know that feeling. As a first-time mum, one of the biggest things that we worry about as mums is, are we going to have a tear? And the likelihood is that having a tear as a first-time mum is generally quite common. In fact, the majority of first-time mums will experience something between a first and second degree tear in their first birth experience. But what's more preferable, to tear naturally or to have an episiotomy? And in order for me to discuss that fully, I want to explain what an episiotomy is. So an episiotomy used to be common practice. It used to be something that was carried out as a matter of procedure for the majority of births. We now know that it's actually not recommended and it's not evidence-based practice. So what is an episiotomy and why would it be done and under what circumstances? Generally they're carried out as a matter of an emergency protocol nowadays, so whereby baby is in distress and needs to get out that little bit quickly. So if you imagine you've got your vagina here and you've got your anal sphincter here. So what you want to do is avoid a 4th degree tear going right down to that anal sphincter where it would impact you in the long term in terms of continence, and it's generally a mediolateral incision, which means it's mostly to the left, but if it's a left-handed person, it can often be down to the right-hand side. And it's done with a little lignocaine injection first to mean that you're less likely to have any sensation of it happening down below. Healing time can be a lot faster or a lot faster with a natural tear than it can be with an episiotomy. I like to give that analogy of all of these lovely fibres sort of knitted together with your tissues, and if you were to cut down the middle of that, it's a lot more difficult for them to sew back together again, whereas a tear that happens naturally tends to come together that little bit better, that little bit faster, and with less kind of long-term damage. So there are lots of things that you can do to reduce the likelihood of tearing. I'm going to redirect you to a video that I'm going to link down below that I did previously, all about things that you can do during that antenatal period to reduce the likelihood of experiencing a tear during your delivery. So go and check that video out first. But now I'm going to dive into some of my top tips for recovering from either a tear or an episiotomy and what you can do to make that postpartum recovery period that little bit easier and a little bit more comfortable for you. So my tip number 1 when it comes to recovery from either a tear or an episiotomy is to start engaging with your pelvic floor early. I'm not talking about doing those pelvic floor squeezes and holding for 10 seconds and trying to increase the tone and the intensity and the duration of those squeezes. I'm talking about engagement, just using your breath. Trying to reconnect with your pelvic floor nice and early has some fantastic benefits to it. The main ones being those for healing. So what you're doing by reconnecting with that pelvic floor is you're sending all of that lovely fresh blood flow that contains all of those healing factors to that area. You're also going to be reducing the edema and the swelling that goes on there. So reconnect with your pelvic floor as soon as you feel able to. So that might be a few hours after delivery, it might be the day after, but the sooner the better. So my next tip actually comes primarily from anecdotal evidence, and that is the use of the homeopathic remedy Arnica. This cannot be used alongside one of the other tips that I'm going to talk about later on, in particular one of the pain relief options that I'm going to discuss. So it's got it sort of counteracted with that, but there is a lot of anecdotal evidence behind the use of Arnica in terms of reducing swelling and reducing bruising to the area. A lot of women swear by it. So my next tip is to use ice packs and cool packs on that area. Just in the same way if you sprained an ankle and you had all of those inflammatory factors driving towards that area, you might have swelling that is accompanied with that. So just with any other trauma, you'll have swelling down below, which can be sort of moderate to significant. So using an ice pack, not directly, so maybe wrapping it in a muslin cloth first, placing it on the area, giving breaks in between so you're not leaving it on all the time, can help to really reduce the swelling in that area and encourage healing to happen a lot faster. So my next two tips are actually in relation to your diet, and it's what a lot of people certainly neglect, particularly in that postpartum period. We're so focused on our baby's needs that we sort of put ours on the back burner. And one of the things that I'm all about teaching and all about supporting is new mothers' entrance into motherhood. Not only a baby is born, but also a mother, and we have to really mind ourselves and encourage all of the healing that takes place after birth. So two of the things that are really important in our diets to encourage healing, particularly of fresh tissue, is your protein content. So the building blocks, those amino acids that make up the building blocks of protein, also are the building blocks for making up healthy skin tissue. So including a healthy source of protein at every meal. If you're struggling to get in a protein intake, you might find getting a really good sort of complex amino acid profile protein powder in a smoothie once a day might be a nice way of getting it in, but also your vitamin C intake. So vitamin C is the precursor to the maker of the collagen, which is forms that aspect of that elastic quality in your skin, which is of course what you want to have bring back that lovely tone and elasticity to that area as it heals. So my next tip is with regards to the pain relief that you choose. And I would always recommend new mums to choose the non-steroidal anti-inflammatory variety, unless of course you have an allergy, so run it by your care provider first if it's something you're not sure about. So the likes of Diphen, Nurofen or ibuprofen, these have an anti-inflammatory content to them, which again comes back to bringing down the swelling in that area and thereby reducing the pain in that area much quicker. So my second to last tip refers to your positioning. So whether you're breastfeeding or formula feeding, the last thing that you want to be doing when you've got lots of healing to do down below is sitting upright on your bottom. If you're breastfeeding, get into a side-lying position in the bed, take the pressure away from that area, or a laid back position where you can scoot your bottom forward so the pressure isn't on that bottom area anymore. Another option, if you do have to sit upright, whether you're sitting down to have a meal or you're sort of slowly phasing back into everyday life, would be to use either a donut cushion or just a simple neck cushion if you have one available. This is just the one that you would use on the airplane. If you have already done my hypnobirthing course, you know that I have other uses for this during that pushing phase and during that kind of second phase of labour. But this can be a really nice way to just sit the bottom into the center there so that you're relieving pressure from that really sensitive area. You can also buy specific donut cushions for this reason, where they are almost like an infant's sort of inflatable ring that you would use for swimming, but they're much smaller in size. So you can inflate those up as much as you like so that you can sit your bottom directly into it, and they're much stronger, so they're not going to burst. But it's a really nice way of taking the pressure off the area, much more comfortable for you, and means that you can sort of get up and about that little bit sooner. My last tip then is terribly glamorous, because everything that I talk about on this channel is glamorous, but that is to avoid straining on the toilet as much as you can. Going to the loo that first time after you've given birth can be a really scary concept, particularly if you have stitches down below. It makes it all the more scary. So my top tips for that would be to avoid straining on the toilet. In doing so, you want to keep your stools soft. So you're talking about taking a stool softener on a daily basis, even up until sort of 2 weeks after birth, or more so if you feel that it's necessary for you. Lactulose is a little syrup that works to soften the stools, so it means that it's much easier for you to go. You could also use a little glass of prune juice, so sort of half a glass of prune juice with the other half being hot water. Drinking that in the morning and then waiting about a half an hour after that, your body should have that natural urge to go. So waiting for the natural urge, not sitting on the toilet and forcing it. You don't want to be doing any straining on that area. You might also find that things are a little bit more comfortable for you if you have your feet up at a slightly more raised level. So naturally, if you look at your anatomy, it's much more comfortable and makes much more sense anatomically for us to be in a sort of semi-squatting position to use the toilet. So having a little stool or maybe just a big encyclopedia for you to pop your feet up onto makes things a lot easier. The other suggestion then with surrounding that would be to have a little bit of support for that area. So you might find having a fresh pad and just holding the area where your stitches are might be a nice way to do it, or indeed just wrapping up a little bit of toilet paper on your hand to support the area. But that can be a really nice way to make it a little bit less frightening and a little bit more comfortable. When it comes to cleaning the area afterwards, I often suggest using baby wipes or wet wipes, the water wipes, for those first few weeks. You might find also just using a gentle squeeze of a peri bottle and then patting dry is a nice way of doing it, but you want to be reducing any aggravation and abrasion to that area while that really sensitive area is healing. So thank you so much for watching. I hope you have learned a little bit of information from this video, and please do go and check out my previous video about what you can do to reduce the likelihood of tearing during birth. If you're interested in this content and more, please make sure and hit that subscribe button and hit the notification bell down below if you want to get notified of when a new video comes out.